Right now we have 129 active cases, and over the last 24 hours, we would have tested 1,251 persons and detected 10 of them to be COVID positive. So we're seeing less cases now, but we still have to be vigilant. In terms of hospitalization, we have currently 13 people in hospital. 6 of those persons are at the Ocean View Hospital, with 1 person in the ICU. So the numbers have come down significantly. They're seeing a resurgence of cases in Europe, especially in the UK. Now cases are going up. And with the increase in cases, they're also seeing increase in hospitalization. A similar thing is happening in France. Now, the clinical picture, however, has not changed. So while this variant is more transmissible, its severity remains pretty much the same. We are also seeing a change in the variants that are circulating in the United States. So you're getting more of the BA2 variant that is now circulating in the US. And generally, we have noticed a pattern. So once we see a variant circulating in the US, we will ultimately see that happening in the Caribbean as well. And in Guyana here, we are likely to see more of the BA2 variant coming here. So it's something that we are monitoring, and as I said, what we have noticed in Europe is once there's the BA2 circulating, you are going to have an increase in cases. So while we have very low numbers right now, I think people still would have to be guarded in how they move around and the precautions that they take. So they still need to take all the necessary precautions like masking and washing your hands and so forth. Paxlovid, it's produced by Pfizer, but the original version can be very expensive. So Pfizer would have entered a deal with the UN patent office, so to speak, pertaining to this particular medicine. And they have now licensed 36 companies around the world in 13 countries to be able to produce a generic version of Paxlovid. And once these companies produce the generic version, it would be made available to 95 countries in lower and middle income so that they can use it to fight the virus. So we are very optimistic that with this move, that Paxlovid would be at a very low cost to countries. And once we're able to access it, then we'll have another tool available to us for treatment. So we look forward to getting Paxlovid, the generic form, in Guyana very soon. For adults, we have 437,495 doses that have been administered to adults. That's about 85.3% of our adult population. We also have 335,495 second doses that have been administered. That's about 65.4% of our adult population. For persons between 12 to 17, we did 34,215 doses. That's about 46.9% of that age cohort. And second dose is approximately 24,875. That's 34.1% of that age cohort. Booster doses, right now we are at 56,848 doses.